My philosophy is exactly the title of that book. I don't want my patients fighting cancer. I think that's a wrong attitude to have right off the bat. This whole thing about, we're going to fight this cancer, I'm going to win it, I'm going to win this battle. I just think that your body is making all this cortisol, you're in a sympathetic state, your parasympathetics are shut down, your immune system is suppressed. Wrong attitude. You got to go, okay, I got cancer. What's the smartest thing to do? We're supposed to call for wisdom first. Ask for wisdom and the right reason. It's promised to give us that wisdom, and then we walk in that wisdom. So, okay, you're dealing with this bump in the road, you got cancer. And it might even take your life. If this is your time to go, it's going to take your life, and I can't even stand in the way of that. So, what are you going to do about it? You know, make sure you make peace with God in the process so you know where you're going when you're gone. But we just got to be wise in everything that we do. So I want my patients living. I don't want them. We do a modified Gerson approach with every one of our patients too. You guys know what Gerson therapy is? We do not do a full Gerson approach. Making a juice every hour on the hour while you're awake and while you're up during the day, and then 5 coffee enemas a day. I'm not living that way. I'd rather die. So I don't want my patients living that way either. So I want them living. I want them going back and getting their job back. I want them playing with their grandkids, you know, pouring your life into other people's life. And let's treat you while you're sleeping. Yes, there's some things that you got to do during the day. Absolutely. So typically, when we see a patient, you want to find out what the cause is. So in my book, this is my important thing. You got to find out what the cause is. Because if you can find out what the cause is and get rid of that cause, you're at least on your road to recovery. For instance, if the cause of my liver cancer here is from a vaccine that I had, the MMR vaccine that I had when I was 3 years old, and whatever toxin that was in there is causing the liver cells to constantly be replicating, I want to do something to get rid of that toxin. And typically that's when we go back to a chelator if it's something like that. I want to chelate that out so that I don't, even though I could wave a magic wand over my liver and the liver cancer goes away, if I don't get rid of the cause, that could be a cause of another primary site cancer someplace else 2-3 years down the road, right? So finding the cause to me is really important. It's not always necessary to kill the cancer, but it's important. Second, we have to find out what specifically, in my book, nutraceutically will help kill that cancer. So nutraceutically means different specific nutrients. There's a lot of different cancer killers. If you do read my book, Stop Fighting Cancer, I have to clarify something. In that book, I go through a whole mess of different nutrients and cancer killers. And in that book, I even say, if you have cancer, you should be on this. If you have cancer, you should be on this. If you have cancer, you should be on this. But I wrote that book for people who will never be able to come to me. In reality, I test the person on everything. Go back to that liver detox pathway understanding. You do not want to overwhelm the liver detox pathways of anybody, let alone somebody that has cancer. So I take a very minimalistic approach to nutraceuticals as well. Even though I know a lot about nutrition, I have a lot of coursework and studies and letters behind my name about nutrition. You do not want to overwhelm the liver detox pathways, even with good things. And patients with cancer typically come in with a basket full of stuff. And my aunt sent me this and said that this works. And my brother sent me this. And my friend sent me this. All very good, well-meaning things. And those are all good things, maybe even. They're great things. I read a book on Protocell, so I started taking Protocell. I read the Hoxsey book, so I started taking this. And SEX, so I'm on this, I'm on this. If you take too many things, you overwhelm the liver and you are not going to get better. So I use, typically my cancer patients are literally on 1 or 2 or 3 things. Number 1, you want to find out what the cause, pull that out. Number 2, you want to find out nutraceutically what's going to kill that rapidly replicating mass as best possible. That's where you got to have a lot of different tools in your tool bag, a lot of different nutraceuticals from a lot of different places that have different, you know, all those things work, but what's going to work on me? And then what are the Rife programs that we're going to use exactly?